Hello, I'm Chelsea Taulman, and I'm a clinical assistant professor at the School of Nursing at Purdue University. So a headache typically feels like pressure or tightness in the head, and it can be uncomfortable, but it is manageable. Whereas a migraine is more severe. It's actually considered a neurological disorder because it is involving the complex brain mechanisms, which means that it's affecting the nervous system, not just the head. Migraines can feel like an intense throbbing or pounding pain. Oftentimes it's only on one side of the head, and then it can be so severe that it affects your everyday life. Triggers can vary from person to person, and some common triggers for migraines can include stress, lack of sleep, lack of food intake or dehydration, even hormonal changes. Other factors that can trigger a migraine can be bright lights, loud sounds, even foods or drinks like red wine, caffeine, aged cheese, and some even say chocolate. And more prevalent right now with the weather changes, when you have that shift in air pressure, that can trigger a migraine. Migraine symptoms are oftentimes more than just head pain. Many individuals report nausea, vomiting, sensitivity to light or sound, or even smells. Other people can have visual disturbances where they're seeing flashes of bright lights in their vision, blind spots, or even zigzag lines. You can also have dizziness, feeling unbalanced. Others even complain of neck pain. And even after the migraine has resolved, individuals will report feeling very fatigued or in a fog state. So if you develop a migraine, the best thing to do is get into a quiet, dark room so that you can rest or sleep. Other things that you can do is apply a cold compress to the forehead or the back of the neck. Some over-the-counter options like ibuprofen or acetaminophen can also help relieve your symptoms, especially if you take them early. You can also make sure to avoid any type of screens. This can definitely worsen your symptoms. And if your symptoms continue to be more frequent or severe, it's always a great idea to talk to your primary care provider about prescription medication to help relieve your migraine. Prevention starts with knowing your body and building good habits. So something that would be beneficial is keeping a journal of when your migraines occur or your headaches. What were the triggers? What were the symptoms? And then what helped? And it won't take too long before you start noticing a pattern and can prevent or avoid those triggers. Other things that you can do is making sure you're getting adequate sleep at night, making sure you're eating a well-balanced diet, staying hydrated, and then it's really important to manage your stress, whether this is through some movement component like walking, even weightlifting or meditation, and then limiting alcohol and caffeine has shown to reduce the occurrence of migraines and headaches.